DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Triangle vaccines. Triangle, protection you can trust.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. I'm tickled to death that you joined us today. We're going to talk about the #1 killer of beef cattle in the United States, bovine respiratory disease. And we're going to talk about how to treat cattle with bovine respiratory disease with Dr. Mike Apley from right here at Kansas State University. Stay tuned.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it has been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Well, Mike, welcome to the show.
Thanks.
Folks, this is Dr. Mike Apley. He's a friend and colleague here at Kansas State University's College of Veterinary Medicine. You know, we've done some things on the road with our Cowboy College and do a lot of work directly with feedlots, directly with our veterinarians and our vet students. And BRD is one of those things that has kind of been one of the things we've worked with a lot.
Main staple, yeah.
Yeah, so we talk about bovine respiratory disease in beef cattle. You know, the big thing that the first thing we have to do is identify sick cattle out in the pen. And what are some of the things that you kind of coach on for picking up one that's not doing right?
Well, one of the things I encourage people to do is, you know, we need a protocol anymore. I think the days of not having written plans are really behind us, and it makes some people squirm, but it forces us to plan and really think about it. And I encourage people to write down what they're looking for, especially for training the next generation or new help. And they may even use a scoring system. Sometimes we use a 0 to 4, where 0's, hey, there's nothing wrong with this calf. 4 is it can't get up. And then we might argue a little bit about 1, 2, or 3 in the middle. But that's a training tool, because by arguing about how ill the animal really is or depressed, that forces us to talk about what we're seeing and then train and interchange about that. So we call it a case definition in veterinary medicine about which ones we'll actually treat, and it shouldn't be all of them in a pen situation. Obviously, we're going to, unless we're applying treatment for control on arrival or something, but we're going in to pick out certain animals, and let's talk about the criteria that we're going to do: depression, how they move, and then we'll have secondary criteria when we get to the chute, and that includes maybe temperature or listening to them or a variety of different things, but that's our main, those two things put together.
And so when we talk about out in the pen, let's do our primary and then let's go through our secondary. But let's get out in the pen. You know, the old DART protocol is pretty hard to beat. But what are some of the things that you're having cowboys, pen riders, farmer feeders look for in identifying a calf that's sick?
Sometimes you got to adjust your dial on the way those cattle are behaving. Mm-hmm. You know, ones that are a little wilder might not allow you to see the illness as quick or as much, and so you have to be a little more tuned into them. Basically, depression, hanging out from the others, it really draws my eye when I go up to a group of calves and everyone moves away except one or two, or some are slower. So really heavily on depression, how well they're eating. I'll sure let a sunken flank make me look over a calf, but I won't let a full belly talk me out of pulling one if I think they're really sick. Respiration rate, depends on the time of the day, as all our listeners would know, and how you evaluate that. But it's one that really stands out as different from the others, and the way they present to you may change in the way they do that as they become more used to you and more comfortable with you and are not viewing you as a predator or a threat to them. So really standing out from others is one way.
Yeah, we're going to take a break, but the big thing, you know, is cattle are kind of like people. You have people that have a hangnail and they miss work for 2 weeks,
Yep.
and you got people that come to work every day with Ebola virus and blood coming out of their eyes, and cattle that get sick and some of them you can identify real easy, and some of them blend in and won't let their
Right.
guard down. But when we come back, we're going to talk more with Dr. Apley about bovine respiratory disease, how to pick out those cattle, and how to treat them. You're watching DocTalk, and we're sure glad you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Meet the Veterinarian, brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Dr. Gordon Hazard from West Point, Mississippi is a legend in the cattle business. A veterinarian for 64 years and a cattleman for 79, Dr. Hazard received the Mississippi Cattleman of the Year Award in 1990 and was inducted into the Mississippi Cattlemen's Hall of Fame in 2012. Also known as the Guru of Grass, Dr. Hazard has authored a widely acclaimed book, Thoughts and Advice from an Old Cattleman.
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey folks, welcome back to DocTalk. We're back with one of our regular guests, Dr. Mike Apley, and we're always tickled to death to have him break free from his busy schedule to come talk to us. Generally, it's about antibiotics or feedlot operations, and every once in a while we might let you talk about a pig, but not
today.
Not today. Today we're going to talk about bovine respiratory disease, and we've got the calf, found the sick one out in the pen, and now we've got them to shoot. And you have a secondary criteria that the doctors or cattle feeders are going to look at, and let's go through those.
Well, and I'd say we found one in the pen might be sick, and
Right.
that's the attitude we want to have to come in. Now, some places will say if they come out of the pen they're going to get treated. I prefer to apply some secondary criteria, and we can use temperature, rectal temperature, and one of the things to do is make sure you got a decent thermometer that's actually reading right. And sometimes we use water baths along with a calibrated thermometer, which may be beyond some of our producers watching to do that. But a good, high-quality thermometer. Invest in a good thermometer.
And our normal rectal temp is 1015 to 1035 in these feeder cattle.
Most of the time, and of course, hot afternoon, it's going to be higher. And but I usually use at least a 1035 to 104 cutoff.
Yep.
And there's going to be some exceptions to that, but if we just make a lot of exceptions, sometimes we end up treating a bunch that don't need to be treated. Another way that people are looking at is listening to the lungs and seeing.
Yeah, when you said it earlier, we're going to listen to the cattle, I was like,
listen to him talk to me.
Hear those little voices.
That's only late at night. It's called auscultation, but listening to their lungs and seeing if there's some sounds there that would direct us one way or the other with them. So there's some secondary criteria to apply in the chute, and you put that together with the fact they came out of the pen, and now you make the decision to treat or not treat.
Right. And sometimes you can adjust, I see some veterinarians adjust their treatment protocol based on primary and secondary criteria. I just, if one's sick, I have pretty much a criteria that this is what they're going to get, just trying to simplify things. But once you've made that decision, we've looked in the pen, we've identified the sick calves, we've brought them up, we've confirmed that the pull was running a high fever and the lungs don't sound very, we don't have good lung sounds. We've got to make a choice on an antibiotic. Mm-hmm. And, we've got about a minute until we go to the break. So if we need to, we can go into the next segment and talk about this as well. But when it gets down to antibiotics, what are some of the big things you're thinking about?
I'm thinking about probably giving it to him just once. And then the big thing that's in my mind when I give an antibiotic is, when am I going to decide whether this animal's responded or not? After I've given this antibiotic, what's the period I'm going to allow for recovery? And then I'll have a plan for yes, no on that. But that's the main thing in my brain.
All right. So, I've read your myths. So, is there any good combination of antibiotics?
No.
Right.
And that's just give one. Yeah.
Just give one antibiotic and give it at the higher dose once rather than the lower doses consecutive days.
And then I go for the antibiotics that are single administration, and which is the majority of them we have now for respiratory disease.
Well, we're going to have to pick this up. Let's take a break and we'll come back. We're going to come back. We're going to talk a little bit more about antibiotics, and then we'll jump into some of the ancillary therapies, which might be an even shorter conversation with the good Dr. Apley. Thanks for joining us. See you here in a minute.
This tip brought to you by Batril 100 Enrofloxacin Injectable. The only enrofloxacin labeled for single-dose administration in cattle is also the only enrofloxacin labeled for control of BRD in high-risk cattle. Batril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Today we're going to talk about taking care of your syringe and cleaning it after you get done. First thing you want to do is take the syringe and clean the outside with warm soapy water, get all the manure and different things off of the syringe. Then you're going to take the syringe apart to clean the inside. On the inside of the syringe, never use soap. Only use warm water to rinse that inside of the syringe out. We're going to let the syringe dry, and after it dries, we want to put it in a dust-free environment. One of the best places, put it in a Ziploc bag and then put it in your freezer. But before you use the syringe for the next time, make sure that you allow that syringe to warm up to room temperature.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Batril 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis in high-risk cattle. Ask your veterinarian about Batril 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Batril 100, right the first time.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with my friend and colleague, Dr. Mike Apley, who is a veterinarian who specializes in feedlot medicine. He specializes in clinical pharmacology. And Mike, I'm just going to bullet list some things.
Okay, we can do that.
The first one is, you know, I've heard people want to use combination therapies, 2 antibiotics versus 1. If 1's good, 3's better. And what's your thoughts?
2 issues with that. Well, several, actually more than 2. One is, you know, can we justify the added cost and the added injection sites, et cetera? 2 is there anything at least publicly available I can access which would suggest that this improves response to therapy, and there just isn't. So I know we can increase costs, we can complicate things. I don't have evidence that increases efficacy. And the 4th is, if you pick the wrong combination, you can inactivate some of those. So for example, the beta-lactams, which include penicillins like penicillin G, cephalosporins like ceftiofur, which we have 3 versions of, those work with the cell wall dividing. So the cell wall has to be clicking along and dividing. So for example, when we have strep throat, those things are dividing every 20 minutes, so they're having to build new cell walls, and those are like slipping a fake brick in there, and they get built and they just crumble, so they die. But if you put in a drug that slows down the growth, like a tetracycline, then those can't work as well because it isn't growing as fast. So sometimes putting 2 things together isn't.
Yeah, and you've even shown me some of the papers in some of the pediatric pneumonia cases where we have decreased treatment response when we use combinations versus using the drugs individually.
Yeah, and you avoid all that by picking one drug. And the other thing is thinking you have to put something with it to get quicker action, and that's just not true either. So many of these things are peak concentration by 3 to 6 hours, and when it's a 6-hour peak concentration by 3, it's really close to it because it's a big gradual arc. So,
how about IV versus sub-Q? Intravenous injection, vein in it?
Vein in it.
Get it in there quick.
Yeah, anymore that's kind of more for show. I think our drugs we have today, even though they're single injection, they get to a pretty rapid concentration gradient. They get pretty quick.
So, and then the other one is single versus multiple treatments of an antibiotic.
I really like the single injection ones.
And the example is, you know, given, let's just use Baytril as an example, 1 big dose of Baytril, the 6 ml per 100 one day versus 3 cc's per 100 3 days in a row.
Right. And you know, we learned something years ago, and back then it was the long-acting oxytetracycline against daily injections. And so they'd get a total of 9 milligrams per pound once with the single injection of the long-acting over 3 days, or they got 5 milligrams per pound every day for 3 days. So they got a total of 15 split up daily, and the 9 milligrams once beat the 15 given it every day. And part of that's just quit messing with them, give them the single injection.
I always say, if you have which one would you rather have? Go into the doctor's office 3 days in a row for treatment, or get 1 dose? We got to take a break. When we come back, we're going to wrap up with BRD with Dr. Mike Apley. We're going to talk about ancillary therapy and some of the things on recovery. You're watching DocTalk, and we're sure glad you joined us. Hi there, folks. Dr. Dan from K-State. Are you BQA certified? Well, if not, you should be. If you work with beef cattle in any aspect, whether it's cow-calf, stocker, or feedlot, or if you work in an auction market, if you're a 4-H or an FFA member, or if you're ancillary to the beef industry, it's something that you need to do and become familiar with. Beef quality assurance has been around for over 25 years, and it serves as a cornerstone of education to help producers identify management processes that can be improved. Not only have those that are involved with the beef industry embraced BQA because it's the right thing to do, they have also gained through increased profitability. Traditionally, BQA training is offered face-to-face through your state coordinator, and it still is. But today, you can also have this educational opportunity, which can be obtained through the Beef Quality Assurance online training provided by Boehringer Ingelheim Vet Medica. Go to the website bivi-bqa.com where you can register and become BQA certified at no cost to you between now and October 31st. Also, if you register and become certified between now and October 31st, you can also be entered into a drawing to win some great prizes, including a tailgate package valued at $500. It's a great program. It's been around for almost 3 decades. It's a cornerstone to safe, wholesome, affordable beef. It's beef quality assurance. Get certified today.
Your cattle are often at risk of respiratory disease caused by Mycoplasma bovis, but MPB Guard vaccine can help prevent those problems early. MPB Guard delivers proven efficacy against Mycoplasma bovis, even on young calves just 45 days old. It also gives you the convenience of an initial 2-dose sub-Q vaccination series, so help guard your cattle from costly respiratory disease caused by Mycoplasma bovis. Just ask your veterinarian about MPB Guard vaccine.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We are having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd. This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Mike Apley here at Kansas State University's College of Veterinary Medicine, talking about BRD treatment. And we kind of hammered on work with your veterinarian, identify cattle early, set up criteria on when you're going to treat them, 1 antibiotic, single dose, sub-Q, and then we get to the question, what else do we give them?
Time.
Time's a good answer.
But that did remind me of one thing,
Okay.
The post-treatment interval, when you give that
Okay.
single injection,
Yep.
you've really got to have a plan for how long it's going to be until you say, are they better or do they need another treatment? And the data's starting to look like that week to 10 days is pretty much the magical spot.
And that's what, when I was in practice and still do some consulting, our treatment interval from first treatment to an animal that is going to need a second one is 11 to 14 days on average. And that's looking at millions of cattle, And so when you're looking at that 7 to 10, even regardless of a 48-hour, the ones I treat day 1, day 3, day 5, I don't buy a big bag of feed for those.
No. Yeah.
Those are checking out.
You can tell where they are, yeah.
So good treatment interval,
Yeah.
7 to 10 days, depending on the types of drugs of when we're going to reevaluate, but do it consistently.
Yeah. So back to your original question.
Yeah. What else are we going to use?
And I still struggle for any evidence. Every year, we talk about thinking about this fall and what's going to happen. I'm still struggling for evidence that putting anything with that antibiotic helps us in long-term recovery and getting that calf back to being a productive animal.
And so we're talking about B vitamins, and folks, we're talking about, when we say ancillary therapy, we're going to give the calf an antibiotic, but we're also maybe going to treat him with something else at that point in time. And I'm with you. I haven't seen anything yet that says that treating with, whether it's B vitamins, IBR vaccination, vitamin C, Banamine or flunixin, meglumine, what else? Dexamethasone.
Yeah, dexamethasone especially. I think there's pretty clear evidence we can do some harm with that one. Definitely some harm besides just not making an outcome difference. And
because of the immunosuppressive actions.
Yeah. And as a matter of fact, dexamethasone in cattle is used as a research model to shut down their white cell function. So,
well, I think the big thing is, and we've got to wrap up, but Closing comments, BRD?
It's pretty straightforward. Case definition, do it consistently so you can have some records you can evaluate. Pick one antibiotic, get with it.
Work with your vet.
Work with your vet. Yeah.
Well, thanks for being here.
You bet.
It's always great to have Dr. Mike Apley from Kansas State University's College of Veterinary Medicine. And thank you for watching DocTalk. Remember, always work with your local veterinarian. And if you want to find out more about what we do at K-State, you can find us on the web at www.vet.ksu.edu. Thanks for watching DocTalk. I appreciate all that you do, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Triangle vaccines. Triangle, protection you can trust.